Hi everyone, welcome back to Allied Health 102 lecture, and I'm recording this video and putting it up on Canvas for you so that the campus obviously is closed. As everyone knows, we had snow and weather that made it unsafe for people to make their way to campus. I'm sorry, guys. However, in an effort not to let us get behind and in a way for you to maximize the time you have, I wanted to record a portion of pick up where we left off on Thursday on the first day of school, pick up from there in lecture and record what I would have went over in the classroom. Now, like I told you guys in the classroom, on Thursday, the first day of school, you need your textbook. Remember, I handed you out your small white binder in lecture. That small white binder has your chapter review guides in it. Remember, while I'm lecturing, I will give you the answers to fill in the blanks on your chapter review guides, and then those chapter review guides are what you study for your test in lecture. Now, my PowerPoint presentations come directly from our textbook. The answers for your chapter review guides are also located in your textbook. I'm going to send out an email today letting everyone know that these videos are on Canvas for you to watch as you were in class and fill out your chapter review guides. Okay, I will include this in my email. If for some reason you can't get to Canvas and you're unable to watch these videos, as I said before, the answers are located inside your textbook. Everyone should have their textbook and should be reading chapters 1, 6, and 7. Now, we're going to get started. We're going to pick up where we left off on Thursday so that we don't get behind. Now, phlebotomy. That's what we're here for, right? So we need to know what the words mean. That's why the medical terminology class is so important, because a lot of times, even if you don't know what the word means, if you have a really good background in medical terminology, you can break that word down and it will tell you literally what that word means. So as a phlebotomist, again, this isn't a job, it's a career, you need to fully understand what the word phlebotomy means. It's derived from a Greek word. The first part, phlebo, it means veins, okay? And then the second half of the word tomy, T-O-M-Y, as you know from medical terminology, this means it's relating to some type of cutting, like cutting into the vein, right? Therefore, the definition can be summarized, as I said, it's some type of cutting or incision into the vein for getting blood out, right? For bloodletting. Okay, it's also synonymous with venous section or venesection. Now, there are also some additional videos embedded into Canvas. There's one talking about what phlebotomists are and what they do. There's some on tourniquet tying. You guys want to start practicing that skill. There's videos on there, and there's also videos on Canvas on donning and doffing of your PPE or personal protective equipment. Guys, use your time wisely. Like I said in class, you're going to get out of this class what you put into it. If you do not bother to go onto Canvas and utilize Canvas's tools that are on there to help you, you won't do as well in this class as you would like. Okay? Now remember, anybody who is collecting blood is doing the job of a phlebotomist, right? And that is the person who most often performs phlebotomy is a phlebotomist. As part of the healthcare team, because the main part of your job is drawing blood, you're going to be best at doing that job. Now, as a phlebotomist, you won't be just collecting blood, you will also be collecting that blood and transporting it and other specimens to the lab. Things like arterial blood, urine, tissue samples, sputum, cerebral spinal fluid, and others. And we'll go over all these things as this class progresses. You'll also be performing types of clerical and clinical and technical functions like computer entries. Okay, your only job is not just to draw blood. There are some other things that go along with doing phlebotomy. Again, we understand though that our primary job as a phlebotomist is the accurate, safe, and reliable collection and transportation of blood and other specimens to the lab so they can be analyzed. Here's one of our critical thinking slides. Guys, this is so important because you want to take everything you learn in both lecture and lab and put it together and be able to critically think through situations you might encounter out in the real world working in hospitals and clinics. Okay? Because that's what this is for. Yes, you have to learn all this stuff, but you're supposed to put it together to critically think through and be able to make those decisions when you're out there working. And remember, you're going to have 10 case studies you're going to have to do in class, and you have to pass 5 of the 10 case studies to be able, with a 70% or better, to be able to pass the class. Why is this so important? Because when you're out there working, you need to be able to take what you've learned, put it all together, and take care of your patients. Also, the ASCP exam is moving towards these types of questions versus just multiple choice questions. So I really want y'all to focus in hard on learning how to do this. So let's take this scenario. You go to work at Christus in the lab as a phlebotomist. What do you think your primary duty will be? Collecting blood, right? I know that one seems simple, but we're starting out slowly and working our way up. That's why it's so important to not get behind, not in my class or any other classes that you're taking. You guys put in the work and you will do well. Okay? So let's talk about some phlebotomy practices and definitions. Okay? So laboratory analysis of specimens are used for 3 purposes. Okay? First, doctors and clinicians use it for diagnostic testing. What does that mean? Figuring out what's wrong with you. Okay, you come in, you're complaining of a sore throat, they swab your throat, they do a strep test, it comes back positive. The doctor thought you might have strep. He uses that lab test that you collected to test that patient. It comes up positive. That's diagnostic testing. There's also therapeutic assessment. What does that mean? That's deciding on the appropriate drug and or treatment that his or her patient needs. So the doctor uses lab testing as a way to do therapeutic assessment and decide what treatment or drug your patient needs. He or she also uses it for monitoring. Okay, so to make sure that whatever therapy he's giving you is working and alleviating your disease. Because if it's not working, then he may need to change your drug or treatment or give you more or less of that drug, right? So, diagnostic, therapeutic, treatment. Now remember, technology has enabled laboratory testing to be performed closer to the point of care. What does that mean? That means in some cases, we can go right at that patient's bedside, stick their finger, run a point of care glucose testing so we can find out right there by the patient's bed what their glucose is so we can make quick decisions on what treatment to do with them. That also means at ancillary places such as a stat lab in the ER, a stat lab in the NICU or in ICU, and also mobile sites where they can go out into the community and do testing on patients, right? Also, patients can test their glucose at home, or you can go out working for a home health and do testing in their home. Now, let's talk about some healthcare settings and some healthcare teams. Things we need to break it down to: there's inpatient and outpatient, right? Most healthcare organizations fit into these 2 categories. Inpatients are patients that are admitted into the hospital, okay? And this is a big deal because as a phlebotomist, there's 2 different worlds. There's a world where phlebotomists sit in an outpatient lab where they wait on the patients, come to them, they draw the blood, and they send the blood over to the lab, and then they run the test, and then the doctor gets the results, and then they can talk to their patients, right? That world is completely different than phlebotomists who draw blood in the hospital up on the floors with patients, where they go from room to room drawing their patient's blood, getting it back down to the lab. The lab runs the lab results. It goes on to the patient's electronic medical record, and then doctors, physicians' assistants, nurses can access that electronic medical record and see their patient's results. Okay, so we need to know there's a difference. Inpatients and outpatients. A lot of times they'll refer to outpatients as ambulatory care. So, again, hospitals are organized into departments. You need to know this wording. Guys, this is not a job, it's a profession. And you want to be able to speak to your colleagues, you want to speak to doctors, you want to be able to speak to your patients intelligently. And as you're working in the hospital, you need to know where these departments are located and a basic understanding of what they do so you can really help your patients. So let's talk about allergy, okay? Everybody understands that, right? It treats the allergy department. They treat patients who have reactions to irritating agents, okay? And we all know you can have an allergic reaction from everything from pollen to bee stings to peanut butter to gluten to all kinds of stuff, right? Anesthesiology. Anesthesiology is that place that deals with not just surgery, putting you to sleep during surgery, okay, but also pain management, okay? And then cardiology, that treats heart and circulatory conditions. You have cardiovascular. These are surgical diagnosis and treatments of blood and heart circulation. There's dermatology. They treat skin conditions. And then you have diagnostic and imaging or radiology. This is radiation for diagnostics and treatment of disease. Now, reason we want to pay a little bit of attention to that is there are some dyes that can be injected into patients when they're getting this diagnostic imaging that can actually interfere with getting the most accurate and reliable lab results. So we need to be aware of that. Then there's ECG and EKG, which is electrocardiography. This records electrical currents produced by your heart. Then EEG records electrical currents produced by your brain. We have the endocrinology, okay, that treats disorders of your hormones. There's family medicine and general practice. They pretty much care for all family members. Gastroenterology treats disorders of not just your stomach, but also your esophagus and your intestines. We know that geriatrics is the people who treat the elderly. We have hematology. These people treat conditions of the blood. Immunology treats conditions of your immune system. Internal medicine treats conditions of one or more of your internal organs. You know, you might start out going to a general physician, right? You don't have a lot of diagnoses, you're relatively healthy. But if it comes to a point where you start having multiple diagnoses, let's just say that you're struggling with obesity, you now have diabetes, and you have early stages of heart disease, you may need to switch from using a general practice doctor to using an internal medicine doctor, as they're a little more advanced on working with one or more internal organs, dealing with people with multiple diagnoses. And then laboratory medicine, right? The pathologist is the doctor. It's important because this is the place where the phlebotomist brings the blood. This is where the analysis of blood takes place, including other body fluids like we spoke about, other things like tissues for diagnosis and treatment and monitoring of those diseases. Also, the neonatal or prenatal, this, treats premature and newborn babies and their mothers. Nephrology deals with the kidneys. Neurology deals with your nervous system. Nuclear medicine, this is where they use radioactive isotopes and tracers. They're used for both diagnostics and treatment of patients. Again, though, because of these radioactive isotopes, these things can interfere with us getting the most accurate and reliable lab results, and we need to be aware of that. Then there's nutrition and dietetics. We need to understand they deal with nutritional analysis of patients, educating patients, and handling patients who are on special diets. We have pediatrics, they treat children. Then we have psychiatry or neurology. These treats mental and emotional issues, including nervous system problems. Obstetrics and gynecology treat reproductive systems of females. We have occupational therapy. This is treatment for rehabilitative activities. Oncology is for cancer. Ophthalmology treats eyes and vision problems. Orthopedics, we know, deals with bones and joints. And orthontology talks about ears, nose, and throat, your ENT. Then we move on to the pharmacy. We understand this is where they dispense the medication. This is another one of those key things as a phlebotomist we need to be aware of, or any clinical laboratory professional, because we need to collaborate with the pharmacy on these time specimens dealing with these medications. And we'll get into that when these patients are on drug therapy. And we'll talk about peaks and troughs. But it's important that these draws or coordinate it with the pharmacy and the nurses to make sure we're drawing them at the correct time. Then there's PT or physical medicine, treating neuromuscular systems. Physical medicine that treats neuromuscular systems, and then right with that is physical therapy. They use hot and cold, they use water, ultrasound, electricity, physical exercise. There are all these tools for them to use to try to restore physical abilities after either an illness or an injury. Then we have plastic surgery, both cosmetic or corrective for deformities. Proctology treats the anus and the rectum. And then pulmonary, this treats your respiratory system. Respiratory therapists treat things like with that lead to breathing disorders. Rheumatology treats joints and tissue disease. We have surgery, the surgery department. We know that's the department where they can alter a part of your body for treatment. Urology treats both sexual and reproductive systems in men, and then renal systems in both men and women. Phlebotomists should become knowledgeable about these areas of the hospital because patients spend time in them prior to, during, and after phlebotomy procedures. Here's another one of our critical thinking slides. In which department would respiratory therapists work? Guys, remember I told you the way to learn is to read and study using whatever tools work good for you. But then at some point you have to put that stuff away and get someone to ask you questions like this, because the real way you learn and lock it in is to put it away and then to pull the answer out of your brain. So you use these critical thinking slides as a great way to learn. So the department in which respiratory therapists work, as we talked about earlier, is the pulmonary department. Which department would work with phlebotomists for patients receiving drug therapy? Do you guys remember what we talked about earlier? The pharmacy, right? Peaks and troughs. Which department would you go to deliver the blood after you draw it? The lab, right? Now let's move on and talk. We're still talking about clinical laboratory and specimen collection services. So a hospital-based clinical laboratory has two components. The first is clinical pathology. We call that the lab, right? You're used to that. That's the part where you see people come in, they bring their blood, it gets tested, right? We also have the anatomic pathology part of the lab. That's the pathology, just a way to break it up. The lab is the clinical pathology. The anatomic pathology is the pathology part. Clinical pathology is where blood, body fluids, and tissues are examined and tested and we get results. Anatomic pathology is where autopsies are performed, histological and cytological procedures, and surgical tissues are examined. For instance, if you have something removed, whether it's a tumor, a skin lesion, even a bullet, if you have a pap smear done, those tissues are brought down to the anatomic pathology department of the lab, and then they're examined for things such as cancer. So the phlebotomist plays a vital role in the process of producing reliable and accurate laboratory results and reports. Guys, you're a vital part of the healthcare team, and what you do is very important. That's why I want you guys to see this as a profession and not a job. This is why I want you to take reading your chapters and studying very, very seriously, because as a phlebotomist, it is a key part of us getting accurate and reliable lab results in the part of the job that you do. Now, we're going to break these down into 3 phases: pre-analytical, analytical, and post-analytical. Now, your pre-analytical phase, we understand from being able to break this word down, pre means before, right? Analytical means the testing part. So this means before testing. This is what happens before testing. This includes the collection of the blood or specimen, transportation of the blood or specimen, when we get it down there, the separation of it, and the storage of the blood prior to testing. All those parts are in the pre-analytical, and we have to make sure we get those things right, because if not, we're not giving the most accurate and reliable lab results. Then we move to the analytical phase. This is what happens during testing. This includes making sure QC has been done, using appropriate methods and equipment, and interpreting our results correctly. And then we understand post-analytical, right? Just like when we talked about pre-analytical is what happens before and for testing. Post-analytical is the phase that happens after testing. This includes reporting final results out, reporting clinical or panic values, and storage or disposal of the specimens. So guys, this is going to be on a test. You need to understand the difference between pre-analytical, analytical, and post-analytical. So let's analyze this situation. A new phlebotomist is trying to fill out information on a form for her supervisor. She enlists your help. The form asks, what phase of laboratory testing would your job as a phlebotomist involve? Can you help her answer this question? The pre-analytical phase, right? So we're still talking about the clinical laboratory and specimen collection services. Now, we understand that the federal government regulates all clinical laboratories. How do they do this? They do this through different departments. They do it through, first and foremost, the Food and Drug Administration, the FDA. Okay? They do it through the Centers for Medicare and Medicaid Services, which we call CMS. They do it through the Department of Health and Human Services. They also regulate clinical laboratories through the Occupational Safety and Health Administration, which is OSHA. Remember, these abbreviations are important. We need to not only know that what the Food and Drug Administration is, but we need to know that FDA is the proper abbreviation for the Food and Drug Administration. And we need to know that the Occupational Safety and Health Administration, that OSHA, OSHA, is the appropriate abbreviation for it. The DOT is the Department of Transportation. Okay? You guys need to know what these federal agencies are, and you need to know the appropriate abbreviation for them. The CMS, which stands for the Centers for Medicare and Medicaid Services, regulates clinical laboratories through the Clinical Laboratory Improvement Amendment of 1988, or CLIA 88. Now, CLIA is a law, okay? It's an amendment that came about in 1988, okay? CLIA. Regulations apply. These regulations that come from CLIA, they apply to any lab, no matter how big or small, that test human specimens. Okay? If you are testing human specimens, whether you're a physician's office laboratory, which POL stands for Physician's Office Laboratory, whether you're doing bedside testing, whether you're in a large lab, a small lab, or medium-sized lab, you have to follow the rules and regulations laid out by CLIA. Remember, any lab that does not meet CLIA requirements will not be allowed to stay open and will be shut down. Now, there's other regulatory agencies over clinical laboratories. There is the International Association of Blood Banks. There's the American Society of Clinical Pathologists, ASCP. There's the College of American Pathologists, CAP. CAP provides accreditation to clinical laboratories that maintain proper quality assurance programs. And then there is the Joint Commission. Joint Commission accredits hospitals. But remember, if your lab is inside a hospital, then Joint Commission accredits you as well. So what law regulates labs? CLIA, right? What does the word regulation mean? Guys, remember, words are important, okay? And you can use these slides, take a second to make sure that you're getting these answers right. A regulation is a rule or a law. Remember, CLIA regulates labs or gives the labs the rules that they need to follow. Which organizations provides accreditations to labs? Remember, CAP, the College of American Pathologists. I know there's a lot out there, guys, but you have to start figuring out what is what. The main thing you need to remember is CLIA is the law, right? Okay? Remember, a regulation is a rule or a law. And remember, CLIA regulates labs or gives the labs the rules that they need to follow. But remember, the College of American Pathologists, CAPS, is the organization that provides accreditation to labs. So if we're talking about that, what does accreditation mean? Accreditation is what we refer to as a stamp of approval. Labs that follow the rules get accredited by CAP. CAP puts their cap of approval on them. Guys, think about this. You never want to go and have your blood drawn and have your lab work tested and reported out by a lab that is not accredited. How would you be able to trust that they're doing it the right way and that they're reporting out accurate and reliable lab results? Remember, doctors are using these lab results to diagnose, monitor, and treat patients, which would mean if you were a patient, that would be you. You would never want to go and have your blood work drawn in a lab that was not accredited. What agency accredits hospitals? JACO, right? Joint Commission. What organizations provide accreditation to clinical laboratories? CAP, right? Guys, keep going over it. Remember, that's how we learn, is to go over it, then put it to a side, have someone ask you the questions that you're filling out right now in your thin white your lecture binder, and this is how you learn. CAP, the College of American Pathologists, is the organization that provides accreditation to clinical laboratories. JACO, or Joint Commission, accredits hospitals. But if your lab is inside a hospital, then you will be accredited by both Joint Commission and CAP. What law regulates clinical laboratories? CLIA, right? CLIA is the law. Okay, so let's get into CLIA. Remember, they set forth the rules and regulations that labs had to follow. So the first thing that CLIA did was they took every laboratory test that there was out there and they grouped them into different categories. So they came up with 3 categories: waived, moderately complex, and highly complex. Wave tests are the easiest to do with the least amount of errors possible when doing them, with the least harm to the patient if something went wrong. Some examples of wave tests are urine dipstick, pregnancy test, and glucose screening test. Then we move up to moderately complex tests. These are still relatively easy. There's a little more risk to the patient if something is not done right, though, okay? These are some examples of that is if we run an RBC, a WBC, a hemoglobin hematocrit, and some chemistry test. Things like CBCs, right? Electrolyte panels and lipid panels. Then there is highly complex tests. These tests are very complex to perform, and there's the greatest risk to the patient if something is not done right. Some examples of highly complex tests are bone marrow evaluations, flow cytometry, and electrophoresis. So remember, CLIA is the law, right? They took all the laboratory tests offered, grouped them into 3 different categories: the WAVE, which are the easiest, moderately complex or a little harder, and then highly complex. So what is the name of the law that regulates clinical laboratories? CLIA, right? What 3 levels are lab tests grouped into under CLIA? We have waived, moderately complex, and highly complex. Guys, you can tell from these critical thinkings, these are the things you really need to know. If you will study your chapter review guides, you will be able to answer those multiple choice questions on our test. And then as you build that knowledge in your mind, if you really know it, if you really studied, then you can use that knowledge to critically think through something you might face out in the field and be able to answer that appropriately. You know that CLIA will be coming to your lab, okay? You work at soon to inspect it. A phlebotomist you work with, a graduate of another program, tells you she's never even heard of CLIA. She wants you to tell her as much as you can about CLIA. Now, if we were in class today, we would pretend with someone in the classroom with you, and you would give them a 30-second spiel and tell them everything you know about CLIA. Since we're at home today on Tuesday because of the weather, find someone in your house and explain CLIA to them without looking at your notes and see if you truly know. Guys, remember, you learn this stuff and then you want to be able to say it to somebody else and explain it. Just memorizing is not what we want, but memorizing it is the first step. Getting this knowledge in your mind, and then once you've really locked it into your mind, then practice explaining it to somebody is what's going to make you really, really knowledgeable, which means not only will you do good in this class, but you'll do good in Allied 211 when you go to clinicals, both in your classroom activities and out at your clinical sites. It'll make you do well on the ASCP exam, and you will be a very impressive phlebotomist to the people around you. Now remember, CLIA is the law. It's not an organization, it's the law that governs all labs, no matter how big or small, that test human specimens. Now remember, under CLIA, all labs are inspected. All laboratory tests fall into 3 categories: waived, moderately complex, and highly complex. If that is not what you said to someone in your house, then I want you to practice it again without looking at your notes until you get it down. Remember, practice is what's going to do you the best good. What agency accredits hospitals? Joint Commission, right? What organization provides accreditation to clinical laboratories that maintain proper quality assurance programs? Take a second, don't look at your notes and see if you can answer it. If you can after a few seconds, then look at your notes and keep doing it until you can answer it without looking at your notes. CAP, right? College of American Pathologists. What is the name of the law that regulates clinical laboratories? I know you guys can all answer this now. CLIA, right? And what 3 levels are lab tests grouped into under CLIA? Remember, waived, moderately complex, and highly complex. Guys, as you're watching this video, you can pause it and see if you get the right answers. Remember, JACO accredits hospitals. But if your lab is inside a hospital, then you're going to also be accredited by a joint commission as well as CAP. Because remember, CAP, or the College of American Pathologists, provides accreditation to clinical laboratories that maintain proper quality assurance programs. Remember, CLIA is the law. Okay, it's not an agency, it's a law that regulates any lab, no matter how big or small, that tests human blood and body fluids. One of the things they did was group all laboratory tests into 3 different categories: waived, moderately complex, and highly complex. Now, clinical laboratories typically have an administrative office and multiple supervisory personnel overseeing specific areas of the lab. The laboratory manager is either a pathologist or a lot of times a medical technologist, or we also refer to them as medical laboratory scientists, who oversee the whole lab. Or sometimes the clinical laboratory is ran by a medical laboratory scientist or a medical technologist, and the anatomical part of the lab is managed by the pathologist, and then both the pathologist and the clinical laboratory scientist work together as a team for the whole lab. Let's talk about sections of the clinical pathology, each with their own supervisor. Let's go over these, okay? There's specimen collection and processing. This is where the phlebotomists work, okay? Then there's clinical chemistry. This is where they test for chemicals in the liquid part of your blood, such as sugar or glucose, fats, proteins, hormones, etc. There's the hematology part of the lab. This is where they do blood counts. This is where they count they do the CBCs. They count your red cells, your white cells, and your platelets, right? Also in the hematology part of the lab is the coagulation department. This is where they test the clotting ability of your blood. Then there's the microbiology, usually parasitology is located inside microbiology in the lab. This is where they look for bacteria, virus, parasites, etc. Okay, in stuff like stool, in stuff like throat swabs, and all kinds of things, right? Then we have immunohematology. That's the blood bank. That's where they decide your blood type, and then they cross-match blood for you to make sure that you get blood that doesn't cause a reaction with you if you need it. Then there's immunology or serology. These test for reactions showing immunity. Then there's urinalysis. Urinalysis is usually in hematology as well. And then there's things like the stat labs that we might have in the ICU or the ER. The clinical laboratory personnel work as team to provide dependable data to the physicians for diagnosing, treating, and monitoring his patients. We play a vital role in helping our doctors be able to diagnose, monitor, and treat our patients. That's why we want to work as professionals and make sure we do the best job we can. That's somebody's family member, right? Now, the pathologist is a doctor with extensive training in pathology and the study and diagnosis of disease through the use of laboratory tests. Then you have what we call technical supervisors. Technical supervisor is a clinical laboratory scientist with additional experience and education in a certain section of the lab, such as hematology, microbiology, or chemistry. The clinical laboratory scientist, CLS, or the medical technologist, MT, or medical laboratory scientist, right, has a bachelor's degree, which includes 1 year of study in a CLS program, has a state license if their state requires one, and takes a national certification exam like the ASCP exam. The ASCP exam is the exam that you will sit for. It is the gold standard for clinical laboratory personnel. They perform lab tests, they run QC and QA, they perform maintenance and troubleshooting on the instruments, they participate in CEWs, and they sometimes teach pathology residents, MT students, and MLT students. The medical laboratory technician, MLT, or clinical laboratory technician, they usually have a 2-year certificate or a lot of times a 2-year associate's degree. They must have a state license if their state requires it, such as the state of Louisiana requires it, and they take a national certification, again, like the ASCP exam that you guys will sit for. They run routine lab tests, prepare specimens and reagents, they draw blood, maintain lab equipment, and they also participate in CEWs, or some people call them CEUs. This is continuing education. The phlebotomists, they must have a high school diploma. So you guys have to have either your high set, your GED, or a copy of your high school diploma, because when we get ready to register for the ASCP exam next semester, when you make it into clinicals, the ASCP will expect you to have a copy of your high school diploma or equivalent. They collect and transport blood. They properly ID their patients. They properly label their blood and specimens, and they promote comfort of the patient. They draw time specimens. They deliver specimens and other blood and process specimens, and they keep accurate records. You want to be able to name 6 types of laboratory personnel who work in the lab. There's pathologist, phlebotomist, medical technologist, medical laboratory technicians, lab managers, technical supervisors. Remember, those are the ones over certain sections like chemistry or hematology. Can you put these personnel in order according to typical laboratory organizational chart? You'll see this in your textbook. Guys, please read chapter 1. Remember, you're going to get as much out of this class as you put into it. Okay? You want to be able to go to the highest to the lowest rankings. There's your laboratory manager, and that could be a pathologist, or it could be a clinical laboratory scientist. If it is a clinical laboratory scientist, they usually work with the pathologist to run the lab. Then after that, after the laboratory manager, there's the pathologist, there's technical supervisors, medical technologists or clinical laboratory scientists, medical laboratory technicians, and phlebotomists. Now, remember, these are about competencies, certification, and professionalism for phlebotomists. First of all, a high school diploma, like I talked about, is required to enter your phlebotomy program. Employers almost always require national certification and attending continuing education programs and experience. We have found this to be true even in rural areas. They prefer national certifications and coming from a certified program. If you want to work anywhere in the nation at these big top hospitals that pay the best money with the best benefits, you want to get your national certification and graduate from an accredited program like our program at BIPSI. Now let's do some professional organization for phlebotomists. What are some professional organizations that offer certification exams? There's a bunch. I'm not going to read all these to you. You guys can read all the way from the NPA all the way down to the NHA. Now, 99% of BIPSI students take the ASCP exam. If you go forward with your education and will go to the LSU Health Science Center and you were to join the clinical laboratory science program, 99% of them also sit for the ASCP exam. When I was going to school, all of the medical laboratory technicians in my graduating class, 99% of them took the ASCP exam. Why? Because the ASCP exam is the gold standard for clinical laboratory professionals. Now, an agency that accredits educational programs, okay, but that does not offer certification exams and does not perform on-site visits is the National Accrediting Agency for Clinical Laboratory Science, or NACLS. NACLS accredits educational programs like BIPSI. BIPSI is an accredited educational program. We're accredited by NACLS. Now, one thing that has changed is they do now perform on-site visits. NACLS came to BIPSI and inspected us and we pass with flying colors. That's the kind of educational program you want to be under, because it means we're doing it correctly and you're getting the best education for the time and money you are spending. So now, what does accreditation mean? You guys can pause this and see if you're getting the right answer. Accreditation means giving you that stamp of approval. Remember that gold stamp saying you're doing it right. That's what it means when you're accredited. BPC's phlebotomy program, as I said, is accredited through an agency that accredits educational programs in phlebotomy, also in clinical laboratory science. There is only one agency that accredits phlebotomy programs. Can you remember the name of that program? NACLS, right? NACLS is the accrediting body that accredits educational institutions. What agency accredits labs? Do y'all remember? CAP, right? Puts a cap on it. What agency accredits hospitals? Joint Commission, right? What agency certifies phlebotomists? Remember your wording. Wording matters when you're taking your tests. Don't get fooled by the words. ASCP, remember that's certification. Don't get confused between laws, organizations, what accredits labs, what accredits hospitals, what certifications. Make sure you're doing your reading and you're going over and over this stuff, making sure you lock it in your brain. You need to know this to do well on your test. Now, many organizations have developed competency statements to describe entry-level skills such as these for phlebotomists. Assessing each blood drawing situation and selecting the proper equipment. That's what you need to learn how to do. How to assess each blood drawing situation and select the proper equipment for that particular situation. They vary depending on your patient. Accurately collecting your specimens. Vitally important that you do that. Identifying sources of error in specimen collection and transportation. So, this is going to be our last slide for today, guys. I hope that y'all fill out your chapter review guides, and then we're going to pick up from here when I see you in the classroom on Thursday. So you have a friend who wants to become a phlebotomist. Can you tell her what it takes to become a phlebotomist legally? Remember, high school diploma. Can you tell her what it takes to get a job? Training in a good program, certification, and experience. Can you tell her how to become registered? Take the national certification exam like the ASCP exam. What are some beginning or entry level skills she will need to have before she will get hired? Guys, this is our last slide for today. Please take the time between now and Thursday to watch this through and fill out your study guides for lecture. Remember, in lab, we'll start up there when we get there, but please use the tools that are in Canvas. There's lots of videos in Canvas. Please start watching them. Use your time wisely, okay? I would have loved to take today off too and not done anything, but I don't want us to get behind. So I wanted to take this time and get this video up for you guys on Canvas so we don't get behind and we make sure we stay on track so that we can learn everything we need to learn before the semester is up. You guys stay warm and stay safe, and hopefully we'll see each other in class on Thursday. Have a good day.